I'm Mackenzie O'Keefe in the CBS in Denver studio. Pfizer has filed an application to get full FDA approval of its vaccine. And could that change people's minds about getting the shot? So to answer that question, our very own medical editor, Dr. Dave Hnida, is here. And Dr. Dave, how is full FDA approval different from the emergency use authorization that Pfizer currently has?
Well, this is obviously a big thing. And there are three things that I think people really need to think about when it comes to a full authorization. The first thing is that it really does signify that the vaccine is safe and it is effective. In order for the emergency use authorization, you basically need about 2 months of pretty solid information and data. But when it comes to a full-blown approval, just like you do with other vaccines and other medications, you need at least 6 months worth of data and information. That's where we are right now. We do see, once again, it's very safe and it is very effective. The second thing to think about is the fact that now that this is no longer an emergency use issue, there may be more leeway when it comes for employers, when it comes to schools and universities, and even the military in terms of making the vaccine a requirement, which is a really big thing because it does give a little bit more standing in terms of just really what this vaccine is all about. And then the third thing to think about, I think it really does instill a little bit more confidence in terms of this vaccine. I think that you really can't look at this as being an experimental vaccine anymore. Anybody who says at this point in time, after authorization, that this really is still experimental, it just is not the case. We have really seen good testing and good results and can have a good sense of confidence in being vaccinated.
Great information. Speaking of that, Pfizer and Moderna are working to get shots authorized for kids. Yet a new survey from Kaiser Family Foundation shows that less than a third of parents say they'll actually get their children vaccinated. What would you say to parents to convince them otherwise?
Well, I think the first thing is to actually take a look at the survey itself. The survey itself found that about 30% of parents were, yeah, we'll go ahead and get our kids vaccinated as soon as we can. About 40 to 50% are kind of like hesitant in a way, but I don't like using the word hesitant. I think at this point in time, they're being a little bit more thoughtful. They are believing that they will have their kids get vaccinated. They just are taking their time and becoming more confident and comfortable that it is an okay thing to do. And so these are folks who are probably going to wind up having their kids vaccinated. And then there is about 20% more who really are, no, my kid is not going to be vaccinated under any circumstances. And when you look at that kind of a breakdown, it really is very similar to what you see in society in general right now for adults. There is a group of adults, about 20%, who just are like, I'm a no-go when it comes to a vaccine, and that is a problem. And so when you talk to parents about things like this, you say, well, please talk to your pediatrician, your family doctor, your healthcare provider, get more information about the vaccine itself, and also recognize that it will protect kids, it will protect the community, and it really will allow kids to get back into school. If you wind up not having remote learning, if you don't have to be doing quarantines all the time, what a great thing. So I really do see vaccines in kids as being a very positive thing. But if parents are being thoughtful, that's also fine. I'm a parent and I totally get that. And if time is what it takes, you've got time to decide. And I think you'll go in the right direction.
Wonderful. When it comes to vaccines, not every employer is requiring them, not even healthcare systems. Is it okay to ask your healthcare provider if they've been vaccinated?
Well, this is a subject I really feel strongly about. I think number one, yes, you do have the right to ask your provider if he or she is vaccinated. On the other hand, your healthcare provider is under no legal obligation to tell you whether he or she is vaccinated. There is healthcare privacy. There are HIPAA rules, and there is certainly, once again, no obligation that someone needs to tell you what their healthcare status is and what their vaccination status is. On the other hand, I take a look at it a little bit farther. And I say to myself, well, number one, I'm going to see somebody. I'm going to an office, a clinic, or a hospital. And I really want to know that I can be confident going to that facility and not be at risk of becoming ill because somebody has turned down a vaccination. And then there's number two. It has to do with the fact that from a philosophical and ethical basis, do I have a healthcare provider who really doesn't care to get vaccinated? Because that's really what it boils down to at this point in time. We would have certainly a difference of opinion about vaccination. And if I have a difference of opinion about vaccination and healthcare, we may have a lot of differences otherwise that really makes a big difference in terms of just how close our relationship is. When you take a look at Colorado, we think about 80% of healthcare workers are in fact vaccinated, a little bit more when it comes to the providers. So really we're talking about staff and so forth, and then the healthcare providers themselves. And I think really the big thing at this point in time, I just say, if you are in the business of healthcare, I want you to care about my health as well as your own health. And so if someone is saying, I don't want to be vaccinated after all this safety information and effectiveness information has come out after a devastating pandemic, perhaps it's time for me and that provider to say, see ya, time for something new.
Very interesting. Well, thank you so much for joining us, Dr. Dave. We appreciate it, as always. We'll talk to you again next Monday at 11 a.m. to get more coronavirus and vaccine questions answered. We'll be right back.